Stella has very kindly come from Innovate UK, where she's Director of Healthy Living and Agriculture, to give us Innovate UK's view on this important question.
Great. So thank you very much for the opportunity to contribute to this really important conversation. And it feels very, very timely, just as you might imagine. Myself and my team were looking very carefully yesterday at the budget and very delighted to see innovation as a key pillar there in that growth mission. So what I'd like to do this morning is to talk a little bit about the role that we play at Innovate UK in innovation, and particularly I'm going to highlight the focus we give to adoption and give you some examples of what we've been doing around that. Now, Innovate UK is the UK's innovation agency, and our role is to really drive economic growth and societal benefit by helping innovative businesses to flourish. And I'll show you a little bit about how we do that. And I'd like to sort of talk a bit about who we are, what we do, and really importantly, why we do it. Now, as I do that, I want to really highlight the fact that obviously I'm going to pull out all our healthcare examples, but as Innovate UK, we actually focus across many, many different sectors. And that actually also enables us to really work at the intersection of those and bring new ideas into different sectors. And for example, I would highlight the creative industries, where we're actually seeing quite a lot of technologies now coming into the healthcare space and offering different ways of solving some of those challenges. So before I speak about Innovate, I'll just spend a couple of moments giving you an introduction to myself. So my name's Stella. I've actually been at Innovate UK for a year now. I joined as the Executive Director of Healthy Living and Agriculture, so that includes covering the healthcare sector. I've recently also picked up another job, which is the Interim Executive Chair of Innovate UK, so I'm wearing a couple of hats at the moment, which is fun. Now, my background is actually as a chemist, and I decided I was sort of moving along in my academic career and thought, I think I'll do 18 months in industry just to get experience of innovation, and then I'll come back to this academic life. Well, those 18 months became over 20 years. I fell in love with the process of innovation, the opportunity to take emerging science and technology and to really use that to address unmet needs. And through those experiences, I've led teams of innovators from the US to Japan. I've done global innovations, worked with literally with many, many different partners as well during that time, and really focusing on innovations that can fit into consumers' lives and effectively make their lives better. So during those 20 years, I've learned many things, and one of them is that this innovation process is by far from a linear process. You've got the ups and downs. I was actually in a panel earlier this week and heard somebody describe it as a roller coaster, and I think many of us would think that's actually a pretty good description of it. So, it's rarely that moment of success, eureka, and it takes a good deal of determination, and also, I think truly, and I'm going to talk about that, and I think Dominic was also sort of alluding to that, is this sense of a system, that you need many players to support those innovations to really grow. And as I hope you'll feel, we're absolutely part of that system. We provide, I think, some really, really important inputs to it, but we also connect to other partners, and I will talk about that. Now, because of all these factors, that innovation is this sort of roller coaster, it means that pathway, that when we think about how we can support those innovative businesses, those pathways are very unique. There's no stereotypical pathway. So what I would like to show you is how what we do is provide different types of interventions and support. Some innovative businesses will use a number of those. Some will use one and then move on to other areas. But it's really, really important that we have that. And if I maybe move on, we do have a couple of slides. This gives you a sense. So as I said, our focus of Innovate UK is to drive UK growth through these innovative businesses. And I guess I really want to debunk the myth that maybe they're in your heads that what we do is grants. Yes, we do grants, but we do many, many other things, and that's really important. And you see some of those highlighted here. So if you've got a great idea, we have iCure. And this can help you to look at the potential, the business potential of that idea. If you're working on some cutting-edge research and you actually want to be able to think about how to bring academia and business together, we've got our knowledge transfer partnerships. A significant investment that we make is in our network of catapults, and those do exactly what the name suggests, I hope. They catapult innovations into the market, supporting that development, that adoption journey. And those are really important. That can provide people with the opportunity to access expertise, but also equipment, capital equipment, to start to go on that scale-up journey. If you've got the makings of a larger business, we have our business growth. That's a network of advisors that can really sort of they work very closely with innovators to support them through that process. And then also the other area I'd highlight is that talent and skills. So we do talent forecasting and think about what are the talent and skills we need to build. We link that in with our catapults as well, developing apprenticeship schemes. And equally, you can look at our Talent and Skills Connect and see what talent is out there. So, key message is a whole range of different types of interventions. And equally, at the other end, if we are talking about cash and funding, we have those grants. But importantly, we have a program around investor partnerships that we bring investors in and as we do that side by side with the grant, it means investors will come in earlier. And that can always help to then really refine the opportunity and help with that commerciality. So we have this whole scheme of products and services. And maybe just to bring it alive, I'll give you 3 examples, particularly from healthcare and actually businesses I've been speaking with this week. So earlier this week, I was in Edinburgh and I met with a former academic, now CEO, who started his business thanks to an iCure award, and he's focused on developing nebulizer technology to step change the use of that for drug delivery. And he now has a team of 15 people and has investments of up to 10 million. And all of that started with that first step around that iCure. We also, and I think this is really important in the space of healthcare innovation and adoption, we also have established a regulatory science innovation network, and we've driven that through our cell and gene therapy catapult. So that's really about how do we, as the innovations are developing, how do we equally develop that regulatory network, that understanding, so that we can move more quickly into market. And then, as I mentioned, the investor partnerships. This has been something that's been really powerful with some of the diagnostic innovations that we've been working with. Again, bringing in those investors early and working together to really drive success there and drive adoption. So hopefully that has given you a real sense, both of 2 things, I hope. The diversity of some of the support that is there to help that development, to help that adoption, but also a sense of some of the amazing projects and activities that we get involved in. So I feel genuinely blessed to be in this role seeing that. And with that in mind, I mean, I love this way of capturing it. What we're trying to do at Innovate, we want to inspire. We want to really inspire innovations. And then we want to involve people in those innovations. We want to bring organizations together. We want to bring people together. And then we want to invest, and we want to drive investment. So that's both convening our own resources, but importantly, convening others. So as we get into that growth and scale up, we work closely with the British Business Bank. We have a memorandum of understanding with the London Stock Exchange. So we can start to really create those pathways that really support that adoption. And then, of course, and again, Dominic spoke about the importance of place, and we know that innovation happens in a place. So when I'm talking about all of this, we are very much talking about the entirety of the UK. Lots of detail here, but key message is that we are really sort of networked into those. We understand where those strengths sit as well in terms of where our where do we see some really fantastic capability around diagnostics? Where are the clusters in drug discovery, for example? And what we find ultimately is that this reach, which is deep and is broad, great. You know, I guess your question could be, so what? Well, actually, what we find and have been able to demonstrate is that where we go with public capital is private capital follows. So the businesses that we work with, they typically go on to raise around 30% more capital than those that don't. So these interventions is helping to really push forward that adoption is absolutely working. So I also said I'd talk about why we do it. Well, of course, you know, I showed you our sort of 3 I's of inspire, involve, invest. For me, there's a 4th that's really important, and it's about that impact. And of course, adoption is critical to that. And actually, it's that impact. When I think back to my sort of 18 months that became 20 years, it was that sense of being able to impact. I'll never forget the first time that I actually saw a consumer picking up one of the products that my team and I had started working on in a lab in the middle of Bedfordshire. And I was sitting in Paris, and they were buying this and putting products in the trolley. And it's that impact, it's that adoption that really drives us. It lured me from the academia to industry, and then it's lured me into the public sector as well. So we are absolutely driven by that impact. So at Innovate UK, it is about every time we see that those businesses progress along that innovation journey, every time we forge a new pathway, every time we understand actually there's a gap, maybe we need to develop a different product or service to address that. And you can measure that again in cash terms. So for every pound that we spend, our pounds as taxpayers, again, we generate around £3.60 of impact as well in the short term. So that's a really good, solid return. So then just to sort of, what I like to do to close is really bring that again back into this sense of innovation for healthcare. So we're really driving forward and focusing, I believe, on the real challenges that our country faces and beyond. Exactly to Dominic's point on place, we don't have to be limited by that. So one of those interventions we also have is about helping innovators access other markets. We know that the UK life sciences industry is is a world leader, and we've heard that already, generating 90 billion in turnover and really driving strong growth. So let me maybe bring it live in terms of some of the innovations that we've been working with. And you see here, as I mentioned when I opened, I'm the Executive Director for Healthy Living and Agriculture, 1 day a week at the moment. And our focus as a team is to really have the focus on that sector, bring those products and services, understand what's needed in the sector, understand in what place, and make sure that we unlock this potential of healthcare. And if I were to I'll pick 3 very different examples, again, to bring it to life for you. One of the big projects or areas we've been working with is with our future health. So a significant public-private partnership. And we now in the UK have the world's biggest cohort, the world's most diverse cohort, over 1 million participants and blood samples in that. So we've been investing to create that cohort. Now our focus will shift to how do we now stimulate innovations with SMEs because of the insights that drives. How do we predict earlier disease, and what will that lead to in 5-10 years' time? So that's one of those examples that we've been driving. Then also, and I mentioned the creative industries when I opened, so we have a mindset mental health program, and that's looking at supporting innovators who, from the digital creative industry, who are bringing that technology with healthcare professionals and developing immersive therapies for people with mental health conditions. So really trying to unlock and, as I say, bringing those 2 different sets of capabilities together. And then my final example, and really important when we're talking about adoption, is we do a lot of work as well in on medicines manufacturing. So it's great to have all of these innovations, but how do we make sure that we can then produce those at scale in the UK, and that also in the event, and this capability was something that we were able to pivot during COVID as well. So there's a lot of work there that we're doing in terms of creating the right capabilities and facilities to produce novel therapeutics at scale, but also in a sustainable way. And again, lots of public-private partnerships are working around that. So finally then, I will conclude, and I hope that you've learned something about what we do. I will look forward to sort of the conversation at the panel, but I would really like to leave you that sense of, our role is to really inspire innovation. Please follow our QR code if you'd like to find out more about it. But thank you very much for your attention and the opportunity to contribute.
The Harley Street Health District, the home of healthcare since 1860.